Hello, and welcome to SSM Health St. Anthony's Hospital Hematology Oncology Chemotherapy Education class. Today we're going to discuss importance of chemotherapy education, what to expect during treatment, and how to manage side effects at home. It is going to be important that while you're listening and watching this video, please have a notepad available. That way you can ask questions at your next appointment or to your physician's nurse. We are here to help you during this process. So communication is the most important piece of your treatment. Our office hours are Monday through Thursday, 8 to 4:30. On Friday, our office hours are 8 to 2. We are closed all major holidays and on the weekends. Our telephone policy, our nurses are so extraordinary at what they do, and they usually return phone calls within the business day. Non-emergent phone calls that are placed after 4 o'clock will be returned the following business day. If you have an emergency, please contact the front desk and let them know that you have an emergency and you need to speak with your physician's nurse. The nurses generally do call our patients back within the business day. It is very important to us that we deliver exceptional care, and we do feel that communication is important to having the best care possible. Our front desk, when you check in for chemotherapy and to see your physician, you will check in with the front desk. What happens when you check in, we want you to have your ID available, your insurance cards, and any other appointment information at the time. Your lab appointment is scheduled 30 minutes before your physician appointment time. It is important that you adhere to the times that you're given. The lab appointment time is so that you can have labs drawn that are important for us to know prior to having chemotherapy. The lab work itself takes about an hour to come back. We cannot treat you in the chemotherapy room without your lab results. So whenever you are checking in with the front desk, make sure that you have your labs drawn. The physicians will see you during that wait time, and then after they're done, the doctors will take you to the checkout desk where you will check in and sign in for chemotherapy treatment. They will have you sit in the waiting room until all of your lab work is back, and we work up your chart and a nurse will be out to get you. If you have waited more than 15 minutes to see the physician, please let the front desk know. We know how important your time is, and so we want to make sure that we are good stewards of your time as well as our time. That's why we ask you to be on time for your lab appointment and your physician appointments. If you're only scheduled for lab that day and treatment, then be prepared to wait an hour for your lab work to come back before your treatment time. It is important to know that we are doing the best that we can, and we will get you back as quickly as your lab work is available to us. For routine medication refills, please contact your pharmacy. Even if your bottle says no refills available, your pharmacy will contact our office for the refill. Many prescriptions require a physician's signature. So it's important that you tell us that you need a refill on your medications 2 to 3 days before your medication is out. Many of our physicians are not always in the office, and they see patients in other areas. So it's important that you let us know as soon as possible when you need a medication refill. It is also our policy that no narcotic medications will be prescribed on the weekends, holidays, or in the evenings. So if your pain medicine is about to run out and you need more, please make sure you do that during business hours. So if you can turn with me to page 4, we are going to start to talk about chemotherapy and what chemotherapy means. And during this course, we're going to go through each page of this book, and we're going to discuss the importance of this book and this class to really help guide anxieties and fears and help maybe answer some questions that you might have going forward with your treatment. So chemotherapy, what is chemotherapy? Chemotherapy is basically chemicals used to kill cancer cells. Every treatment is different. We have 5 physicians here. They all follow the NCCN guidelines. That is a national standard. Chemotherapy treatment is based upon your cancer diagnosis and the staging. How it works is that chemotherapy interrupts cell division and causes cell death. And you're thinking, how do I know that? What does that mean to me? Well, our cancer cells grow rapidly and uncontrollably. When in contact with normal cells, the cancer cells takes over and continues to divide many times over again. The body becomes overburdened with cancer cells. Chemotherapy drugs interrupts the cell's ability to grow and multiply. This is why chemotherapy works. This is also the reason why we have side effects of chemotherapy. When we are interrupting normal healthy cells that are not attached to cancer cells, we're causing the normal cells death. And so it creates hair loss, mouth sores, diarrhea, and nausea and vomiting. What we're going to discuss in this class is how to manage those side effects so that you can be at ease just a little bit. Our goal with chemotherapy is to cure cancer. That is our goal for everybody. We don't want anybody to have cancer. We know that sometimes that's not possible. So we also give you chemotherapy in addition to radiation or surgery. Sometimes we need that little bit of help. And it also hits the cancer cells at different angles. That's why we add in those different sources and those different treatments. Sometimes we need to just control our cancer. So basically what this means is we know that we can't cure the cancer, but we want to help stop the growth so that we can have a better quality of life. How chemotherapy is given? Chemotherapy is given many different ways. It is given directly through the vein. Infusions can last 30 minutes up to 8 hours, sometimes even overnight with a pump, and your nurse will go over that specifically with you. Chemotherapy can also be given through shots and pills as well. Again, how you get chemotherapy depends on what type of cancer you have and what is the best option and best treatment option for you, as planned out by your oncologist. Turn with me to page 6, and we're going to talk about targeted therapies. Targeted therapies are something that is added to your chemotherapy, and it does exactly what it says. It targets specific cancer cells. Depending on the type of cancer that you have and whether or not your cancer expresses a specific characteristic will determine if you are eligible to receive a targeted therapy. Targeted therapies can come in pill form, and they also can come in IV form. Your doctor will discuss with you if you're eligible for targeted therapy. A permanent IV catheter. A permanent IV catheter is an implanted port. Chemotherapy is extremely harsh on the veins. Therefore, your doctor may opt for you to have an implanted port. This is what a port looks like. It will set into your chest cavity. It is a surgery procedure that will be scheduled by your physician or your physician's nurse. Depending on what type of chemotherapy that you will be receiving, your physician will discuss with you if a port is necessary or a peripheral IV for your chemotherapy is optimal. We can start an IV in your arms that we use during your treatment every time that you come in. The peripheral IV, what we will do is we'll check for blood return before we give you the chemotherapy to make sure that your IV is still good. When you have a peripheral IV in, we want to make sure that you communicate with your nurse to make sure that the IV is okay, that it's not hurting, burning, or stinging, or that there's no swelling at the IV site during your treatment. If at any point that you notice a problem with your IV, communicate with your nurse to let her know. That way we can make sure that you are safe. The port is a permanent catheter that is placed on your chest. The port is placed during surgery or interventional radiology. If you have opted to get a port and your doctor feels like that it is best for you to have a port, your nurse will call you in something called Emla cream. Emla cream is something that you get at the pharmacy. It is a lidocaine cream. What you do is you put this cream over your port site, a big old dollop over your port site, and you cover it with saran wrap. You want to do this about an hour before you're seen in the treatment room. The best thing to do when covering your port is you want to cover it with saran wrap, cling wrap, anything that will cover that cream on your port, and it will stay there and adhere there. Do not wipe it off. Once you come back to the treatment room, your nurse will wipe it off and we will clean your port really well. It is really, really awesome thing to have. I would love to have Emla cream. I don't like needles. I know that a lot of people find that funny and humorous that I'm a nurse, but I don't like needles, and so an Emla cream would be a must on my list to have. So, going over again how to use Emla cream, you want to put a big old dollop over your port site, cover it with some cling wrap or saran wrap, anything that does not have a cotton backing. That way it doesn't soak into your clothing or that cotton, and it works properly. If you do it right, you should not feel the needle that we will use when accessing your port. Your port, the port needle will not stay in unless you're getting chemotherapy infused. If you do have to go home with a pump for 2 days, then we will talk to you about how to care for your port site and what to do. If you do not have a port needle in, you can shower, you can bathe, you can swim, you can do anything having that port in because it is covered by your skin. How long will treatment last? Everybody's treatment is different, and it depends on how well you respond to your treatment and what the treatment protocol is. Your physician will be talking to you as you're going through the process of chemotherapy and discussing with you, making sure that you are having minimal side effects, managing the side effects well, and we will be doing follow-up scans and blood work periodically once you're done with treatment to make sure that everything is going according to plan. On page 8, it talks about, can I take other medications during my treatment? Yes, you can. It is important and imperative that you let us know any new medication that is prescribed to you. This is important because certain medications can interact with chemotherapy. So we want to make sure that you are safe. That is our primary goal, and we want you to have the best care possible. So in order to do that, if you are prescribed a new medication, just make sure you let your physician's nurse know or the treatment room nurse know that you have a new medication. We also tell you before taking anything over the counter such as Lamodal or Imodium AD, call and talk to your physician's nurse first. make sure that it's okay with them that you're taking an antidiarrheal. You should also avoid aspirin products unless prescribed by a physician. We will kind of get into the why that's important in a few pages. For minor pain relief, we want you to use Tylenol. We also want you to avoid any antioxidants or supplements unless directed by your oncologist. It is okay for you to take a multivitamin. However, anything outside of that, we want to make sure that you let the physician know before you take any supplements. Also, please notify your physician if you're starting to take the CBD oil or THC. It is important that they know exactly and everything that you're taking. On page 9, will I experience side effects of chemotherapy? Absolutely. I would love to sit here and tell you that you won't experience any side effect of chemotherapy. I would be lying to you. At some point during your treatment, you will experience maybe 1, 2, or more of these side effects. The key will be in knowledge of how to manage the side effects. And that is what we're going to talk about. The first side effect that we're going to talk about is bone marrow suppression. And you think, what does this mean? Well, when you get chemotherapy, remember we talked about your good cells and your bad cells. Your bad cells being the cancer cells. Your good cells being your normal healthy cells. When you get chemotherapy and we're interrupting normal healthy cell growth, we're causing cell death. And when we do that, it can hit your bones, your bone marrow, 7 to 14 days after your chemotherapy treatment. What that means is in our bones, our white blood cells are made, our red blood cells, and our platelets. They are all made in our bones. And so when we stop the growth and we're stopping this process, it's slowing the making of those cells. It does take our bones, they will recover, and they will produce these healthy cells again. It just takes it a little bit. The more that you get chemotherapy, the longer it can take for your bone marrow to recover. This is why it's important that we get lab work before every chemotherapy treatment. We are monitoring your lab work every single time. And what we are looking for is we're looking at your CBC. On your CBC, this is going to tell us what your white blood cell count is doing, your hemoglobin and hematocrit, which what that is it tells us if you're anemic or not, and then your platelets. Your platelets are your clotting factor, so they're really important to us. On page 11, it talks about understanding your CBC, and you're thinking, how do I don't even know what this means. So if you can highlight or circle or star the first two, which is a WBC, the second one is a NEU, and then the last three, HGB, HCT, and PLT. If you can star those or highlight those, we're going to talk about those a little bit more. The WBC and a NEU, what this is our white blood cells. Our white blood cells are so important to us because they fight infections. The NEU is our neutrophils. They are the ones that are actually doing the fighting for us. So it's really important that we are monitoring this lab work to make sure that you are strong enough to have chemotherapy. Our hemoglobin and hematocrit, they carry oxygen and nutrients to our organs. These are important because they tell us if we're anemic or not. Sometimes if we get short of breath just by walking to the bathroom or the kitchen, it could mean that we are anemic and our red blood cells are low. Our platelets, the last one, is our clotting factors. They're the first ones on the scene to stop any bleeding that may, if you cut yourself or your gums are bleeding, our platelets are going to be the first one there to try to stop any bleeding. So this is all made in our bones. And so when we get chemotherapy, these 5 things, they're going to be lowered. And so how you're going to know that is on page 34. If you could turn to page 34, hold your place on page 11 and turn to page 34. It talks about a chemotherapy record. And what this is not a record for us. This is a record for you. And what this record is when you come in for chemotherapy, you can give this to the nurse. The nurse will write down the date, what drugs you're getting, what your lab work is that day, and your vital signs. Why that this is important is for a few reasons. One, we all have that family member that likes to ask you 5,000 questions, and you sometimes can't always answer what they're asking and they get frustrated, right? We all have that one family member. So what this does is if you fill this out, you can just hand it to them and they can know what's going on. You can see the trends in your white blood cells. You can see if they're going down or if they're coming back up. And then most importantly, this whole process has probably been a hurry up and wait and a hurry up and wait, and you feel a little bit of out of control. And so you want some sense of control. And this record, this chemotherapy record, will help you have a little bit of control feeling that you know what's going on. Lastly, if you have to see another physician and they are outside of the St. Anthony's network and they're asking you like what you're taking, you probably won't be able to pronounce these really long words. And so it's just easier if you hand this book to them and say, hey, this is what chemo I'm on. They'll be like, oh, okay, well, we might need to do some further testing or explore other avenues. So this is not something that you have to do, but this is something that we recommend for you to do, and bring it with you every time. Turning back to page 12, we're going to talk more about our white blood cells and what our white blood cells do for us. Our white blood cells, they fight infections. So anytime that we're sick, our natural immune system kicks in and they activate our white blood cells to fight the infection for us. When we get chemotherapy and we lower our white blood cell count, your body's ability to fight infections are going to be lowered tremendously. Therefore, there's some things that we ask you to do when taking chemotherapy. Just some precautions at home to do. Make sure that you call our office if you have a temperature over 100.5 degrees or above. Now, with that being said, you're probably thinking, 100.5, really? My normal temperature is 99.7. Well, that may be true. However, when you're getting chemotherapy, things change. And so even at the 100.5, your body may not be able to fight something off by itself, and we need to investigate what's going on to make sure that you don't need any extra help. So day or night, call us if your temperature is 100.5 degrees or above. We want to stay away from people that are sick. I know that that goes without saying. However, sometimes people don't think that they're sick. So this is a good way for you just to make sure you're doing good hand hygiene. Make sure right now wear a mask if it's applicable. It's okay to tell people like, hey, if you've been around anybody sick, please stay away from me until you know that you're better or that they are better, because it is imperative for you not to get sick yourself. Avoid foods that may be contaminated with bacteria. You want to make sure all fruits and vegetables are washed thoroughly. Meats are cooked thoroughly. check expiration dates. We want to make sure that any sources of bacteria we want to eliminate because they could be harmful for us. Avoid sources of stagnant water, denture cups, respiratory equipment, humidifier. Any of that water needs to be changed daily. Avoid contact with animal litter and kitty litter, fish tanks, bird cages. We don't want you to touch any of that, okay? Make sure you have another family member help you out if possible. Practice good hygiene. Bacteria lives on our skin. It is everywhere. It's something that we cannot avoid. So make sure that you practice good basic hygiene, that you're bathing daily, you're doing good mouth care, oral care, brushing our teeth daily, calling us before having any dental work done. This is important because if you have a temperature or if you get a routine cleaning and your platelets are low, your risks for bleeding are high. So we want to make sure that you let us know before having any dental work done. We're going to protect ourselves from cuts, burns, any injuries, scrapes. We want to clean those. We want to clean that immediately with soap and water, and then just monitoring it and make sure that it's improving. We want to use lotions and moisturizers because sometimes chemo can cause the skin to be dry. And so we want to make sure we're using a good moisturizer every day to keep our skin good and hydrated. If you are a woman still having menstrual periods, we want to use pads versus tampons, and you can have sex during chemo. Report the following: any temperature over 100.5 degrees or above, any hard shaking or chills, a burning frequency with urination, a new cough, sore throat, or sinus drainage, any redness from your port site or the IV site, and chest pain or difficulty breathing. Definitely let us know immediately. Any signs and symptoms of an infection, redness, swelling, itching, let us know, okay? We want to make sure that we are helping you any way we can. On the next page, page 14, we're going to talk about our red blood cells. Our red blood cells are the hemoglobin and hematocrit. Our red blood cells are important to us because they carry oxygen and nutrients to our organs and tissues. What happens is whenever we show signs of anemia, we're oftentimes tired, fatigued, dizzy, short of breath, pale, cold. This can happen with chemotherapy. What we want you to do to manage signs of anemia is make sure you're getting plenty of rest. It's okay to take naps during the day. Try not to sleep all day and be bedridden during the day. We want to make sure that you are up, moving around, doing light activities, things that you try to do before, but it is okay to take a nap during the day. Prioritize or limit your activities, and making sure that you're eating a well-balanced diet. It is so important that you're eating and drinking water during chemotherapy. Platelets, page 15. We are going to talk about our platelets. Platelets are your clotting factor. They're the first ones on the scene to prevent any bleeding if you were to cut yourself. Sometimes Oklahoma weather is so crazy, you don't know if you're going to get dry air causing your nose to bleed. And so it is really important that you know how to manage side effects of low platelet count. Besides bleeding, you can have bruising, small red pinpoint spots on your skin. You can have bumps that are black on your tongue. Nosebleeds will be frequently if your platelets are low. And then if you have a severe headache or sudden vision changes, please go to the ER. Management of a low platelet count. We want you to avoid aspirin products unless directed by a physician. This is because if you were to have low platelets and you take a bunch of ibuprofen, then your risk of bleeding just becomes greater. We want to make sure that your oncologist approves you to take ibuprofen. So please, if you're somebody that prefers ibuprofen or naproxen sodium over Tylenol, please make sure that you talk to your oncologist. We want to use a soft bristle toothbrush. Clean your nose gently by blowing, not digging, as my child would do. And then, of course, taking care of your cuts and burns immediately. You can use an electric shaver, but make sure that you have used an electric shaver before chemotherapy to make sure that you don't cut yourself. Any bleeding lasting longer than 10 minutes, please notify us. And then we want to avoid enemas if possible. On page 16, we're going to talk about hair loss. And hair loss is something that is very important to us because we know for women, mostly women and men, it is something that's very tragic whenever you're going through chemotherapy. There's a lot of resources in the back of the book. American Cancer Society, they have a wig room. You can get a prescription from your oncologist to get a wig. Most insurance companies do pay for one wig during treatment. But not all chemotherapies make you lose your hair. So let me say that again. Not all chemotherapies will make you lose your hair. Some chemotherapies can cause your hair to thin, but some can cause your hair to fall out. If you are receiving a chemotherapy that does make you lose your hair, it can happen about 2 to 2.5 weeks after your treatment. Your hair will generally, once you're done with chemo, will come back in about 4 to 5 weeks. It will start growing back. When it does, it generally will come back a different color and a different style. So if you're somebody that has straight hair and has always wanted curly hair, that could be something that to look forward to when you're done with chemotherapy. We have to look for the lights everywhere, right? A couple of things to think about whenever you are getting chemo and you are losing your hair. So if you're somebody that has long hair, you want to try to cut it shorter. If you cut it in stages, whenever you start to lose your hair, it may not be as traumatic. I understand that it is traumatic. However, we want to make sure that we're easing into the process as best as we can. Whenever you go to brush your hair, make sure that you're not using a hard brush. You want to use a wide tooth comb, and this is because your hair can come out in clumps. And oftentimes whenever your hair does come out in clumps, that's whenever it really hits women hard, that it's real and that your hair's falling out. So you want to use a wide tooth comb. You can also use a satin pillowcase. This also will just kind of help. This will help you help your hair, not necessarily keep it from falling out, but it will just protect your head. Oklahoma's weather, again, is so crazy. You don't know if it's going to be hot or cold or sunny or cloudy. So you want to make sure that if you are losing your hair, and you don't want to wear a ball cap or a scarf over your head, then you want to make sure you put sunscreen on your head. You do lose a lot of body heat through your head, and so we want to make sure that we keep it protected as best as we can. American Cancer Society also has many resources for bonnets, scarves, and different hair wraps that are available to you. In the back of the book, there is a number for American Cancer Society. There's also a nonprofit organization called Tenaciously Teal for women that want to have a shave party. And sometimes it helps you. A lot of women that have done that loved being able to do that with this organization. And it just kind of makes the process a little easier if you're able to be with your friends and have some support while you're going through this. The next thing we're going to talk about is nausea and vomiting. Nausea and vomiting is probably one of the #1 feared side effects of chemotherapy. Many patients will experience nausea and vomiting at some point during their treatment, but what I'm going to do is help you, give you some tricks on how to manage your nausea. Nausea can occur 1 to 3 days after your chemotherapy treatment. During chemo, we will give you some nausea medicine. We will ask you when you come in, how are you doing? Did you have any nausea? We want to make sure that your meds are working. Whenever you get chemo and you see your physician, they will send you a prescription for nausea. Each one of our physicians is different, so make sure that you take your medications as prescribed by your oncologist. If your medication is not working, then please make sure you communicate that with us. They will instruct you on how to take your medication as well as possibly adding additional medication. A couple of other things that you can do to manage nausea. One, if you're nauseated because you haven't ate anything, because you're afraid to throw up, take your nausea medicine about 30 minutes before you eat. When you do that, you want to make sure that you're not eating something fried and fatty. Make sure you eat something that's going to be a little lighter on your stomach. That way you know if you're going to be able to keep it down or not. If that is the case and you're able to tolerate it, then add something else, and you can do this frequently throughout the day. Eat small meals throughout the day. Sometimes we're nauseated just because we don't have anything on our stomach. And so it's important to keep our nutrition up. We need to fuel our body. So make sure that small little snacks throughout the day, and it will possibly help us keep the nausea down. We want to brush our teeth after we eat. Sometimes the taste in our mouth can cause us to be nauseated. Drink carbonated beverages such as Sprite or ginger ale, or even sucking on ice chips. Sometimes hard candy also can take the taste away and can help our nausea. Do not lie flat after eating. What it's going to do is it's just going to help the flow of that food to come back, and you probably will throw up if you go lay down after you eat. Avoid odors. Your senses are going to be heightened during chemotherapy, so make sure you take your nausea medicine with you wherever you go. Most of our physicians will prescribe Zofran. Zofran is something that you can take under your tongue and it will dissolve. If you could be out at Walmart and somebody walk by with a really strong perfume on, and if they do, it can trigger your nausea. And so you want to be prepared in case that does happen. So make sure you take your nausea medicine with you wherever you go. Some of the nausea medicines can make you sick, so make sure that you do not drive or make any important decisions until you know how your nausea medicine is going to work for you. Make sure that you're drinking plenty of water. It is extremely important that we're staying hydrated during chemotherapy. And then if your nausea is not relieved by your medications, or you cannot even take your medications because you continue to throw them up, please call and let us know. We want to make sure that you're not nauseated. On page 18, we're going to talk about your loss of appetite. Chemo can just make things not taste very good. And we have been taught all of our life to eat because food is good, right? I understand. However, when you're getting chemo, it can cause you to lose that sense of and that taste of how wonderful food can taste. It can leave the taste in your mouth metallic. It can create nausea. And so we just don't want to eat because it tastes horrible. So it is important for us to switch our mentality from eating because it tastes good and we like to do it, to eating to fuel our body. So while you're getting chemotherapy, we have to fuel our body and get our body what it needs to fight the cancer cells, not just with chemo. When we stay adequately hydrated, and when I say that, 8 to 10 8-ounce glasses of water a day is pretty adequately hydrated. So you want to make sure that you're drinking plenty of water. Let me say it again, 8 to 10 8-ounce glasses of water a day. And I know you're going, that's a lot of water. Well, I understand. However, it's important that we flush out our system and we get this chemo out as quickly as possible. When we're eating, if our portion sizes start getting smaller, then we want to make sure that we're adding in a nutritional supplement such as Boost or Ensure. We do have a nutritionist that we can set you up with that will help get you tricks as well as to how to get extra calories. We do not want you to lose weight during chemo. It never fails. There's always somebody that's thinking, I'm going to lose that extra 10 pounds that I've been holding on to for 15 years. Well, we don't want you to do that. We want you to maintain your body weight. If you're somebody that is kind of nauseated, but we don't want to eat either, we want to make sure you're not eating fried fatty foods until you know how well you're going to tolerate those foods. We want to eat good quality foods, lots of vegetables, lots of green leafy vegetables. Protein is very, very important. Make sure that whenever you're preparing your food, you're eating with somebody or you're with your family, something to make it enjoyable, not just a checklist that we made. We want to make sure that it's enjoyable. Make sure you chew your food thoroughly. Don't just try to rush through everything. Make sure you're chewing it thoroughly and getting everything that you need. On page 19, we're going to talk about alterations in taste and smell. We kind of talked about it a little bit already. Chemo changes your senses and it increases your senses. What we can do is we can chew on gum, suck on some hard candy to try to change our taste in our mouth. You can also marinate your foods in some wine, soy sauce, any type of marinade that maybe give it a little more flavor so it doesn't taste so bland. The other thing that we suggest you do is we tell you to switch your utensils from metal to plastic. This is because chemo can cause a metal taste in your mouth. And if we are eating with a fork that we all have in our kitchen and we put it in our mouth, the last thing that we're going to taste is the metal. We no longer want to eat, right? And so it's important for us to eat to keep our nutrition up. Therefore, we tell you just to switch it out to plastic. We want to make sure that we're eliminating that metal source. That way you're getting what you need. On page 20, we're going to talk about mouth sores. Chemotherapy can damage the lining of your mouth, causing irritation and ulcers. This can happen anywhere from 5 to 12 days after your chemotherapy treatment. What we can do to help manage our mouth sores, it is important that if you start noticing any pain in your mouth whenever you're swallowing or taking a drink of something, that you start a mouth rinse. That's in your book. It says, make your own mouthwash. You can mix 1 teaspoon of salt, a teaspoon of baking soda, and mix it in a quart of water. You can use this solution 5 to 6 times a day. If this solution is not working, call us and let us know. You can also get Biotine over the counter. You want to use a mouth rinse and brush your teeth frequently before and after meals. If you start to have mouth sores, we want to keep our mouth good and clean because we don't want to create any more problems or infections that would deter us to get off of our chemotherapy schedule. We want to make sure that you check with your doctor or your nurse before having any routine cleanings or any dental work done. And this is just because we want to make sure that you are healthy enough to have, we want to make sure that you don't have any problems during chemotherapy that would deter your chemotherapy. Symptom management, we want to avoid foods that are highly acidic. We want to make sure that, and again, this is only if you have mouth sores, tomatoes, oranges, grapefruits, all those things will sting and burn your mouth. Potato chips, foods that are rough, smoking, all those things will just continue to damage the lining of your mouth. So until your mouth heals, we want to make sure that we're avoiding anything acidic or rough. You can eat a lot of mashed potatoes, yogurts, ice cream, nectars, pears. Use a straw to help bypass the sores and get it where it needs to go. If your mouth sores persist and you've tried everything in this book, call us and let us know. If you're not eating, you're not getting the nutrients that you need. You're not getting the best care. So we have to know if your mouth sores are not going away. On page 21, we're going to talk about constipation. Constipation can occur during chemotherapy. Some drugs can cause constipation. We want to make sure that you're drinking 8 to 10 8-ounce glasses of water a day. I know it's a lot. If you're somebody that already deals with constipation, you can start a laxative. We have listed under the constipation section many laxatives that you can try or stool softeners that you can start with. If you have not had a bowel movement in 3 days, then you need to call us, okay? Start a laxative, and then in 3 days, if you haven't had a bowel movement, then you need to call us. On page 22, we're going to talk about diarrhea. Some chemos can cause diarrhea. And diarrhea is so important that we know kind of what's going on, because when you have diarrhea, we're excreting important electrolytes that's in our body out through our stool. And if we're not drinking enough water and we're not eating enough foods, then we won't be able to replace the important electrolytes that we need. What this looks like is our muscles become cramping, our brain becomes foggy, and we become really weak and dehydrated. So if you're having diarrhea, then we want you to increase your bananas, applesauce, rice, and toast. Make sure you're eating small, frequent meals throughout the day. Avoid nuts and whole grains. If you start to have diarrhea, call your nurse and ask her if you can start Imodium AD. Okay? She will kind of go through you as to why you're having diarrhea. And it's important that you are honest with her about your stools. I know that it's gross and a lot of people don't like to talk about it, but it is extremely important. If you're having more than 6 stools in a 24-hour period, again, please call us. We will probably have you come in, check your labs, and make sure that your electrolytes are okay. Try your best to drink plenty of water, and try to get down an Ensure or Boost or anything that will give you some sort of nutrition if you're having diarrhea. Skin changes. Chemotherapy can cause your skin to become dry and cracked. Sometimes it can cause peeling as well. So we want to make sure that you are using a good moisturizer, keeping your skin good and hydrated, drinking water, and then it can make you sensitive to the sun. So please make sure that if you're outside, you're wearing sunscreen. Neuropathy. Some chemos can cause neuropathy. What neuropathy feels like, it's numbness and tingling on your hands and feet. And what I best describe it as is if you've sat on your foot for too long and that pins and needly feeling that you feel, that's what neuropathy can feel like. With chemo, it can kind of come and go, and it can kind of come and stay a little bit longer, and then it can kind of come and just stay. So at the beginning feeling of that, of the pins and needly feeling, let us know, let your doctor's nurse know that, hey, this is starting to happen. They will monitor you. If you're somebody that already deals with neuropathy, then we want you to monitor it. And if it gets worse or if it changes, then let us know. The biggest thing to remember with neuropathy is if you start to have it or if you already have it, we won't be able to feel our fingertips real well or the bottoms of our feet real well. So make sure that you are, you're checking the temperature of the water of your shower, your bath, your dishwasher, if you're washing dishes, before you stick your whole hand in there, because if you can't feel that temperature, it can cause problems. Page 24, we're going to talk about sex. You can have sex while you're on chemotherapy. Please remember that chemotherapy is excreted through your body fluids. Therefore, you can pass along chemotherapy to your partner. We tell you that it is okay for you to wear a condom while you are having sex. It's actually best. If you are a female, birth control is something that we recommend because we don't want you to get pregnant while you're on chemotherapy. And you also want to consider sperm banking or egg banking. You want to make sure that if you want to have children after you have had chemotherapy, that option is available for you. If you'd like more information about sperm banking or freezing your eggs, then please talk to your doctor's nurse. Some symptoms of sex changes for women is it can decrease your libido. Your menstrual cycles can become irregular or stop. You can have symptoms of menopause, such as hot flashes or vaginal dryness, and then it can be painful during intercourse. Emotional changes, page 25. Chemotherapy is hard. It's hard on you as the patient. It's hard on your family member. So it's extremely important that you communicate with us how you're feeling, how you're doing. Our treatment room, we try to make it as fun as possible. We try to treat you as if you were our family getting chemo. Our chairs, they recline, they have massage, they have heat in them, and we do have warm blankets available for you. Let us know. Many of our nurses, they will pray with you. I've cried with patients. I've listened to them. We want to help you through this process. We have a social worker on staff. Her name is Kathy. She is amazing. She will help you find resources as well. We just want to know how we can help you as the patient. As a caregiver, it is extremely hard to care for somebody that you love during chemotherapy. We understand the role that you are playing as well. So please, if you're the caregiver and you also need help talking through things, encouragement, or even a prayer, please ask us. We will be more than willing to help you during this time. Eye and vision changes. While you receive chemotherapy, it can cause your vision to change. So please note that if you do start to notice your vision is changing, follow up with your eye doctor. Just know that your prescription may change again once you're done with chemotherapy, but also let us know if you are having some vision problems. On page 26, we're going to talk about cognitive dysfunction. It is a fancy word for chemo brain. Chemo brain is extremely real. It happens to everybody. Don't get frustrated. Family, don't get frustrated. If your loved one has asked you the same question 10 times, or if you forgot where your keys are, it is important to know that it's okay. What we can do here is try to put your keys in the same place. Write down things that are important. Make a list so we don't forget things that we need to do that day. Just main thing is don't get frustrated. And you do have an excuse. I always like to tell patients that if you forget about something and your family gets upset or your friend gets upset because you forgot to meet them somewhere, you can always say, "Oh, I've had chemo," and instantly they're going to feel sorry for you. So don't be afraid to just say, "Hey, I got chemo, I forgot." On page 27 through page 28 and 29, it just talks about different protein boosters, snack boosters that we recommend. Again, nutrition is extremely important. If you feel that you're losing weight or you're not eating what you should, talk to your doctor's nurse, your oncologist nurse, and they will set you up with our nutritionist. Diabetics, know that your blood sugar may fluctuate during chemotherapy, and that's because we give you a steroid. And so just know that we want you to monitor your blood sugar a little bit closer than you are probably right now. The last thing we're going to talk about is on page 39. It says, "Don't panic, please call." This means that you're available to speak to somebody in our office 24 hours a day, 7 days a week. It is important that you know what's going on, as well as our physicians. We have 5 physicians here in our office, and they all rotate call every weekend. So if you're somebody that says, "Should I call, should I not call? I don't want to bother the doctor," on page 39, it will have a list of different reasons that you can call us. A temperature over 100.5, any severe chills or shaking, a new shortness of breath, nausea and vomiting that has been going on for over 24 hours that's not relieved by medication. Look at the list and see if what is going on with you meets the criteria on this list. If it does, then call our office 228-7100. If you have to call us after hours, please make sure that whenever you talk to the answering service and the physician calls you back, that you answer the phone even if it's from a number that you don't recognize. Once you're speaking to the physician, make sure that you have your drug allergies and a 24-hour pharmacy phone number available. That way, if they need to call in any medication for you at that time, they're able to do so. This helps you get the best care the quickest. If for some reason you do have to call us in the middle of the night, please make sure that when you speak to the physician, they may direct you to go to the emergency department. This is just for your safety as well. So communication is very important. The side effects that are listed on page 39, any of the side effects that are listed on this page that talks about the reasons to call us, we want to make sure that you get the best care possible. And so communication is very important for the success of your treatment. If you have any questions at all, please do not hesitate to ask, call, my chart message, or ask at your next appointment. We are more than welcome and more than willing to answer every one of your questions for you to help you through this process. Hello, and welcome to SSM Health, St. Anthony's Hospital, Hematology, Oncology, Immunotherapy class. A patient's guide to immuno-oncology. Things to know about your cancer and immunotherapy. There are many treatments available for your cancer. Immunotherapy is one of the newest treatments out. Immunotherapies are really cool. They actually use your immune system to help fight the cancer cells. How does immunotherapy work in fighting my cancer? Immunotherapies flags your body's own immune system to fight cancer cells. Imagine your body as a garden. The fertilizer to your garden is your immune system. Weeds in a garden are your bad cancer cells. And so what the immunotherapy does is it flags the weeds, your cancer cells. That way the immunotherapy can specifically target the bad cancer cells. So we are using your own body to fight the cancer cells. When we do that, it can create inflammation in your body. Immunotherapies can cause inflammation in your stomach lining. It can cause inflammation in your lungs. And it can create diarrhea and shortness of breath. That's why it's extremely important that you let us know if you're having any diarrhea before taking any medications to stop the diarrhea. Possible side effects of immunotherapies. Call your doctor right away if you develop any symptoms or problems. A new worsening cough, chest pain, or shortness of breath. Intestinal problems, diarrhea, blood in your stool, severe stomach pain. Yellowing of your eyes, severe nausea, pain in your abdomen. Decreased urine, or how much you're urinating, blood in your urine. Loss of appetite, extreme headache, weight changes, extreme thirst, dizziness, hair loss. We want to know how to help you. And if you're experiencing any one of these side effects, it is something that needs to be reported to your doctor's nurse immediately. The last thing we're going to talk about is don't panic, please call. It's in the very back of your book. If for some reason you do have to call us in the middle of the night, please make sure that when you speak to the physician, they may direct you to go to the emergency department. This is just for your safety as well. We want to make sure that you get the best care possible, and so communication is very important for the success of your treatment. During the day, if you're experiencing any one of these side effects on this page, please call us. We want to be able to help you and give you the best care possible. Please have your cancer diagnosis, a 24-hour pharmacy, and any drug allergies that you might have. This is because we do have 5 physicians, and your physician may not be on call that weekend. We want to be able to give you the best care possible while you're having a problem. Therefore, if you have the information that we need, we are able to get you what you need the quickest. If you have any questions regarding your immunotherapy, please contact your oncologist nurse, and we will be able to answer any questions that you might have. Thank you.